From the News Channel 5 Network, this is Morning Line.
Okay. Good morning, everyone. Thanks for joining us on Morning Line. Nick Barris here. This morning, we're going to talk about something that's, I think, on a lot of people's minds, not just locally, but nationally. And what we're discussing is health care. We're going to open up the phone lines. And as I mentioned earlier this week, we saw a lot happening in Washington, D.C. Plans to repeal and to come up with a replacement plan look like they pretty much failed at this point, all right? But is that the end of it? And what does it mean with what we have now about whether we're going to have impacts here in Tennessee with TennCare, what it means for those of you who are on Medicare or Medicaid? A lot of unanswered questions, and part of it stems from the fact that there are going to be changes at some point down the road, and there's a lot of confusion when it comes to your health care. It's kind of scary when you're not exactly sure what's going to happen with you. So we thought we're going to do a series of programs. Tomorrow we're going to have Senator Jim Tracy on to talk about specifically things happening in Tennessee with lawmakers. But today, more importantly, we have two professors from Vanderbilt who are in a position to talk about this. Take your questions. We just jumped onto the show because I was talking to them leading up to it. I forgot to plug in because it's so interesting about what's happening. So 737-7587 if you want to jump in. Let's introduce our guests to you this morning. Saye Nikpe is with us this morning. You are Assistant Professor of Health Policy, Vanderbilt Medical School.
That's right.
Nice to have you on.
Thank you. I'm honored to be here.
Well, it's a pleasure. And Andrew Goodman-Bacon, Assistant Professor, Department of Economics at Vanderbilt. So we've got it covered a bit, and what I was really into just before the show was, as we saw what happened yesterday, and Mitch McConnell and the others, doesn't look like a replacement plan has the support. Certainly their plan didn't have the support among Republicans. Donald Trump saying, well, I'm just going to let Obamacare fail. And I'm like, well, how can that be if they're not doing anything? All right. Isn't it status quo? And you were doing a great job of explaining to me, so maybe for our viewers to understand, how can, in the president's words, this be allowed to fail? I thought it's up and running, and they're not making a change, so doesn't it stay the same? So
the Affordable Care Act is up and running, and it's a well-established program at this point. Yeah. People have come to depend on it. And when we passed this law 8 years ago, it was a bill that was about this thick. I mean, it was so thick. It had so many things in it. But, that's in law, and that's in statute. But in order to make this well-established program continue to work, the administration has to do things to kind of upkeep. So
like any administration will have to do that to follow and go along with the law.
That's right. So you have to release funds so that certain types of subsidies for people who buy health insurance on the exchanges become available. You have to publicize the open enrollment period so people know that it's time to buy health insurance. All of these things matter because even though the architecture is set up and there are exchanges, there are Medicaid expansions, people won't jump in there and buy health insurance, and that could contribute to instability in the
So
health
what you're saying markets. Is that if the administration chose, okay, we're not repealing it, we don't have a replacement, but we can choose not to really participate with some of these guidelines that need to be there. And thus, now if you do that though, without a replacement, you just choose it to fail, what is the practical effect on Americans who are on the plan?
It would be really quite bad because we would have, there are 6% of people in Tennessee that depend on marketplace coverage or coverage purchased through the individual market. And that may not seem like a big fraction, 6%, but for those people who depend on it, these are people who don't have access to insurance through their employer. They can't get on Medicaid. They need this coverage, and lots of people have never had coverage before, and they're getting it through the Affordable Care Act. So not doing those things that would help to keep the market stable means two things. It might mean that those people might be less likely to sign up for coverage because it's less affordable to them. And second, it means that insurers in Tennessee are going to be kind of nervous about offering policies in the marketplaces because they're worried that the administration is going to do exactly this and not do the things it needs to do to stabilize these markets, and that makes them skittish about offering. And you see things like I think Blue Cross Blue Shield just asked for a 20% rate hike for next year. Cigna is, I think, asking for double that.
Is that right?
It is. It's true. And a lot of that rate increase comes from the fear that these markets are not going to be properly stabilized because the Trump administration won't, release the funds to make things like cost-sharing subsidies available. or kind of there are all these behind the scenes payments that we would never hear about them because they're extremely technical, but those payments have to be released so that these markets remain stabilized.
Understand, and that's why there's a lot of folks that are unsettled out there. Now, it's so complicated. The president himself, I think, as he got into this, recognized it as well. The economics of it, Andrew, and why, the Republicans, wanting to do this on their own, they control everything, but they can't even reach an agreement among themselves. What do you think it is? Why is it? And maybe, spell it out why they weren't able to come up with a plan.
They tackled a lot in the bill that just kind of fell apart yesterday. Yeah. It actually wasn't a pure ACA repeal bill. That would have involved scaling back the ACA's Medicaid expansions, which largely apply to childless adults, who are only a small share of all of the folks that get Medicaid. Okay. That program actually covers lots of children, pregnant mothers, disabled adults, the elderly, and so the slice of it that's related to the ACA is actually only a small subset of Medicaid. And it would have involved changing the way that they finance cost sharing for folks on the exchanges and a lot of this stuff. What they actually did was to include other very fundamental changes to the entire Medicaid program in that bill. They were going to drastically alter the way that the federal government shares costs of Medicaid with the states. And they needed that because another part of what that bill contained was a lot of removing a lot of taxes that were part of the ACA. Yeah. Taxes on health insurers, health insurance CEO earnings, taxes on higher income folks who are paying into Medicare, taxes on medical device makers. And so an important goal of Republican legislators was to remove those taxes.
Yeah, lower the taxes.
But to pay for it, they needed to make these fundamental changes to Medicaid. So one potential reason why the bill was so difficult to get through and why it fell apart yesterday is because it wasn't a pure ACA repeal bill, which many Republicans have agreed upon in the past in some version or another. It actually tackled a much wider range of health policy issues, and that was a lot harder to bring a broad coalition of folks on board with.
Yeah, and it was just really the handful of some of the more moderate Republicans that came out last night that said they couldn't support it, and that was basically it. And you think that was what their biggest concerns were the things that were not specifically with the repeal, but maybe some of these other issues you just mentioned?
I think that's certainly a concern for a lot of moderate Republicans. Yeah, a number of them from ACA expansion states, and so even the ACA-related Medicaid repeal would affect them. And then there are a lot of Republicans who are from states who are really feeling the brunt of things like the opioid epidemic, where traditional Medicaid does quite a bit to treat, for example, babies born with neonatal abstinence syndrome. That's something that's a large problem here in Tennessee. And also providing lots of sort of naloxone and other drugs to treat opioid overdose issues in a very acute sense for adult populations.
Yeah, and that can be expensive, some of that. All right, if you would, I want to give you each a chance, just for our viewers, the basics about just Medicaid's history and what it provides. And Medicare as well. Do you mind just giving a primer for them? You do a lot better job than I could on that. Do you mind?
Yeah, I teach an undergraduate course at Vanderbilt, and we do this every semester.
Good. Well, we got to know this stuff. So.
Yes. So Medicaid and Medicare, they are two bedrocks of U.S. healthcare coverage. So in the U.S., we've got the majority of people covered by their employer, but then to cover people who are elderly or people who are disabled, we have Medicare, and then we also have Medicaid, which we typically think of as a program that covers low-income people, but Medicaid is actually it is one of the biggest programs. I think it may be the biggest health insurance program in terms of the number of people it touches. So Medicaid is covering low-income children. That's the biggest group on Medicaid. It's also covering adults, and in the states that expanded Medicaid, it's covering a lot more childless adults. But it's also covering children with disabilities, adults with disabilities, and importantly, it's covering a lot of people who are in nursing homes. Grandma and grandpa, to get nursing home coverage, they often rely on Medicaid, and that kind of bleeds up into the middle income.
Where the Medicaid might pay for some of their nursing home care if they have no other means.
It is a huge, actually, long-term care is one of the biggest categories of Medicaid expenditures, and I think people don't always realize that it actually is a program that subsidizes a lot of long-term care.
You forget, you don't hear about that because Medicare does not pay for nursing home.
It does not, very short stays.
Yes, very short stays, but Medicaid, for those who are, again though, all those that you talked about, have to be, I don't know, how close are they to the poverty line in terms of their income or resources?
It depends. So in Kentucky, where they've expanded Medicaid, adults, I tell this to my students because some of them are probably going to leave and do something, and maybe they won't get a job right away. And if they were to become impoverished, if they had an income as a single person of about $11,000, maybe $15,000, they could get Medicaid if they lived in Kentucky. But here in Tennessee, there is basically no income level that they could get coverage at if they don't have some other qualifying reason. So a particular disability, having a child, those are reasons that you can get on Medicaid in Tennessee. But if you're just a childless adult, they're really, there's no income level that automatically makes you eligible for Medicaid.
Okay, so as we sit here right now, and again, in Tennessee, is there a number on how many folks are on Medicaid?
It's about
1.5 million.
1.5 million. So as we sit right now with what's in disarray in D.C., and we're not sure where we're going exactly, it's still, though, for now anyway, status quo. Is it not under the system that we're under right now, correct?
Yes.
In terms of Medicaid, I think
Pretty
that's
much.
right.
Where do you think is it changed otherwise to this point?
Well, the agreement between the federal and the state governments that governs the way that Medicaid is paid for has been essentially the same for 50 years at this point. States put that program in place in the late 1960s, and it covered many of the groups we've talked about: poor children, disabled adults, the elderly, and it has expanded since then. Actually, Tennessee in the 90s was really at the forefront of Medicaid expansion. In 1994, Tennessee put TennCare in place, and it really changed a lot of the way that Medicaid works. Folks got moved over to managed care organizations, so this is Tennessee using Medicaid money to pay managed care insurance companies to provide insurance, and a lot of new groups, of people were allowed on the program. So one really important group that gained coverage in Tennessee at that time, that in some ways resembles the categories of people that are in theory eligible under ACA Medicaid expansions, was uninsurable adults. So folks who could prove to the TennCare office that they had been denied insurance in the past year, I think. And then that program ran into large cost increases, which actually relates in a pretty specific way to the proposed changes on the federal level we can talk about later. And then there was a huge retraction in 2005. And so a lot of those folks lost their TennCare coverage at that point.
By the way, as we go to the break, though, under whatever revisions they were looking at, which at this point have failed, they were going to keep that, weren't they, the pre-existing condition waiver? Or
so
was
it
that
depends. In the House, they said states could decide whether or not they wanted to exclude people with pre-existing conditions. In the Senate bill, that feature was not included. There are other things that may cut back on the value of insurance for people who have certain types of conditions, and we can talk about those. Okay, let's take a break on that note. When we come back, we've got some phone calls, and clearly they're professors. They do a good job of explaining things. This is complex stuff. We'll take a break, back with more of your questions, and we'll start taking your phone calls and more of our conversation with our guests right after this. Stay with us.